guys, my name is Freddie Cordova. I am assigned to Chapter 6 and I'll be covering Medicare with everybody. So the chapter key points for this chapter to be considering is when it comes to Medicare, you definitely want to know the history and its importance of Medicare, understanding the problems and of both programs of Medicare and Medicaid, understanding the current benefits and the finances, analyzing the legislative attempts, covering all the reforms and all the changes that have occurred for Medicare, understanding also the importance of how important it is for the provisions of fraud and abusive laws when it comes to Medicare. These are the key points that I'll be covering throughout the presentation. So, the history of Medicare, President B. Johnson and the Congress, the 89th Congress, they went ahead and introduced healthcare and made it from an individual's responsibility, and they were able to do it more of a macro level, making it a social responsibility for everybody and allowing them to give them more access, to Americans, which is good, right? President Johnson then, when he came into office, he signed the Medicare and Medicaid, and he made it into law. And that can be found in the Social Security Amendments of 1965. So, Medicare can be broken down from Medicare's. In 1965, Medicare was initially began. Both parts A and B were introduced. A covered hospital care, B covered outpatient care, including the physician's care. Part C was later introduced in 1997 by the Balanced Budget Act of 1997. Part D was followed Part C in 2003, which covered outpatient prescription coverage. And then in 2015, Obama went ahead and altered Part B, changing in the reimbursement and how that functioned. So, as you can see throughout the whole presentation of this chapter, there's going to be a lot of amendments, changes, and reform to healthcare, and I foresee that it's still going to be in the future. There's going to be a lot of changes to come, as it's always going to be evolving. Medicare eligibility. Who can qualify for Medicare? So, it's a federally funded program that provides healthcare insurance for Americans who are over the age of 65. In 1972, the expansion of Medicare came about, which included 65 years or younger, but they had to meet a disability. Balancing federal budget, people who were born in the 1960s or later could not collect the full Social Security benefits until the age of 67. What are the benefits? In 1966, Medicare covered 7 basic principles. As you can see that they're there. These principles, the inpatient hospital services, outpatient diagnosis services, physicians and other medical services, outpatient therapeutic services, preventative services and hospice coverage, skilled nursing facility coverage. These are all things that could be found in Medicare Part A, B, C, and D. Okay, so these services are scattered throughout those. It's something to keep in mind. When it comes to financing, in 2015, Medicare is financed by 3 primary sources: the general revenue, which makes up 41%, payroll tax contributions 38%, and the beneficiary premiums are 13%. And there is that 8%, but it's the textbook lists it as under other. Medicare Part A, B, and D are broken down in the textbook, where those finances are coming from. For example, Part A is financed through your taxings. It's also split by your employer and your payroll. So the textbook goes more into detail as to how that's broken down and how it is financed. In 2012, Medicare does not pay for the beneficiary's health expenditures. As you can see, for an example, an expenditure of $18,988, Medicare would paid 64% in that example. Now keep in mind that Medicare, you have to be the age of 65. So for baby boomers populations, those who were born in 1946 and 1964, healthcare reform law projects that Medicare is going to be consistent all the way to 2028. What does that mean? That means that Medicare is going to be highly demanded and serviceable to that population. The reimbursement to providers. Part A reimburses hospital services based on retroactive and reasonable costs. Part B reimburses physicians and outpatient services passed on reasonable and customary charges. So to ensure quality, Medicare implemented and required hospitals to either pass a Joint Commission accreditation visit or undergo a Medicare certification visit. Again, this is Medicare's way of ensuring quality. In 1983, the Social Security Amendment established a prospective payment rates for each diagnosis related group. What does that mean? Social Security came up with these rates to establish the payment of how much they would pay. Expenditures. Baby boomers began turning 65 in 2011. An estimated 7,918 baby boomers will turn 65 each day until 2029. The Census Bureau projects that 20.7% of the total population will be 65 years older in 2029. The legislative attempts section to control the healthcare costs. Again, as I mentioned in the beginning, the healthcare there's been a lot of reform, a lot of changes over the years. And again, it could be ranging from financing to the type of quality that's being provided, quality of services that are being provided. There's always going to be room for change and reform. The federal government here discovered early that Medicare use and resulting costs had been underprojected and that retroactive cost-based reimbursements to hospitals and charge-based reimbursements were inflationary. What does that mean? Is that there was too much room, there was too much wiggle room. So they had to bring that down and harness it. Healthcare reform, there's a lot of legislations that were passed ranging from 1971 all the way to 2015, which is why it's important to vote and to think about who you want in Congress, because these types of legislations and these changes are introduced by your vote and are influenced by you. So keep that in mind. The Health Insurance Portability and Accountability Act, we all know it as HIPAA. It is designed to provide health insurance and be more accessible to working families and their children. It estimated 25 million Americans to be covered. They include pre-existing medical conditions. It provides protection for Americans that move from one job to the other. It provides protection for those who are self-employed. HIPAA Administrative Simplification Act. mandated by HIPAA, they published final rules on 5 standards: transactions in code sets, national providers identifiers, national employer identifiers, and privacy and security. Healthcare claims that the reduce of volume of paperwork and save the healthcare system billions of dollars while providing better services for providers, insurers, and patients. The privacy and security under HIPAA. Privacy, patients' medical records, and other healthcare information. The providers have to keep confidential the records. Providers include hospitals, physicians, health plans, and insurance companies. In 2005 and 2006, there was an instance where Providence Health Services were fined $1,000 for leaving backup tapes and optimal discs and laptops unattended. Those things were stolen, and the health information of 386,000 patients were compromised. The case was resolved in 2008. In 2009, CVS Caremark agreed to $0.25 million settlement for failing to maintain and protected health information in a secure manner. So HIPAA protects our information as a consumer from being divulged. The Recovery Audit Contractor Demonstration Project was established in 2003. It's known as RAC. It's defined as a private business that detects and recovers improper Medicare payments to providers. For example, the project identified almost $1 billion in improper payments in the three states that were reviewed at the time. The most common improper payment was for surgical procedures provided in the wrong setting. In 2007, the federal government authorized RAC audits in every state. The Affordable Care Act of 2010. The ACA, the Affordable Care Act, after several revisions later from the Supreme Court, the latest being in 2016, 22 million Americans, 13% were covered by healthcare insurance, 13 million were covered under the Medicaid expansion, and 9 million through the health insurance. So with the reform and with the changes, more Americans were able to benefit. Fraud and abuse. Fraud is defined as an intentional misrepresentation of facts designed to induce reliance by another. Abuse is defined as unintentional misrepresentation of fact. Both of these result in criminal and civil liabilities and administrative sanctions. So it's very important that facilities that they prevent fraud and abuse within their facilities. Government initiatives and fraud and abuse. There is the Health Insurance Profitability and Accountability Act that was passed in 1996. These initiatives, it ranged, all the way to 2007, Medicare Fraud Strike Force, and in between there are other types of initiatives. For example, the Medicare Integrity Program. So there are initiatives, there are programs to prevent fraud and abuse. For example, the anti-kickback. This one prohibits anyone from knowingly or willfully soliciting and accepting any type of induced referrals. So basically scamming. There's criminal and civil fees, fines, and imprisonment. The Stark Law was passed in 1999, which is similar to the anti-kickback. This one prohibits physicians from referring patients to an entity with which the order physician has an ownership interest. So again, this helps with avoiding any illegal referrals. The 7 Requirements Compliance Program follows these 7 core elements. The first one being implementation. An implementation of written policies, procedures, and standards of conduct. Designation of a compliance officer. Number 3, development of training and educational programs. Number 4, creation of a hotline or other measures for receiving complaints and procedures for protecting callers from retaliation. Performance of internal audits to monitor compliance. Number 6, enforcement of standards through well-publicized disciplinary directives. Number 7, prompt corrective actions in response to detected offenses. That concludes my presentation for Medicare. Thank you for watching.